Hello, Facebook community. I am Dr. Boselli from Concord Orthopaedics, and we are having a 1 o'clock Facebook live chat today. So I'm hoping a few people can tune in. I've never done this before, and I've spoken to a lot of large audiences in my career, but I find this a little nerve-wracking for whatever reason. So feel free to chime in with questions and comments. It looks like a few people are kind of starting to hop online to take a peek. So I'm looking forward to seeing everybody. I just got a hello from Concord Orthopaedics, which is nice. So I'll kind of get used to the flow of this. And as we go along, I can try to answer as many questions as I possibly can. We'll probably go for maybe a half an hour here and cover questions or concerns and kind of talk about the basics. So just as a quick summary, for those of you who don't know me or already work at Concord Orthopaedics, I'm a shoulder and sports surgeon. With the practice, I'm coming to you from my dining room. Many of us are working partially from home or full-time from home right now with the current coronavirus situation. So we thought this would be a good way to kind of get a little, just kind of personal glimpse into what are some of us personally doing to cope with this situation. What ways can our practice still help to serve you in this difficult situation? So, like I said, if anyone has a question, you can feel free to chime in. It's funny, I gave a talk last year for Concord Hospital to a relatively small group of people. It was maybe 25 people. And I don't recall feeling, nervous at all during that presentation, but I found out after the fact that they were actually broadcasting it live to the entire Concord Hospital community on Facebook. So it's maybe good that I didn't know about that in advance. So just a few points I wanted to bring up until we kind of get any questions coming through. Concord Orthopaedics right now is still open. We're really focusing on trying to see any sort of urgent or emergent issues in the office. So we are still available during this difficult time for patients who are in need, who are in acute pain, who have acute injuries or fractures, especially patients who are trying to keep out of the emergency room, which I think many people are trying to stay out of a hospital setting when possible. We're taking really, compulsive precautions as much as we possibly can to try to maintain patient safety. We're screening patients at the door. We have a group of employees. All of our employees have been phenomenal through this process, who have been screening and taking patients' temperatures, asking about travel history, basically running through routine CDC precautions before office visits to make sure that patients can safely be seen. The one thing I would say is we are kind of limiting the number of visitors that come with you to an appointment, just to try to minimize office traffic. So if you are coming in, we're trying to just limit it, to a patient or a close support person if that's necessary. And obviously compulsive cleaning of the office. You'll see when you come in, don't be alarmed. A lot of the providers are wearing masks full time. So your doctor might be wearing a mask during your appointment. That's just to help protect you and to help protect us. And you'll see the same of the medical assistants. Many of the people at the check-in and check-out desks might be wearing a mask as well at the time that they see you. Our walk-in clinic is open. Many of you know we have typically a walk-in clinic that usually has more extended hours. Right now, our clinic is just running between 9 and 4. Again, that's great for, I think I broke my finger. I think I sprained my knee. I need to get looked at acutely and I don't want to go to the emergency room. That's a great option for patients. So that is still open from 9 to 4, Monday through Friday. So we still want to provide that service for our patients. And so that's kind of the basic Concord Orthopedic updates. So we've got a bunch of viewers now, which is good. Personally, how am I kind of dealing with this crisis? It's been kind of a wild ride for the past few weeks. As someone who works in the healthcare field, you sort of always assume that your job is very stable. I would say that you can kind of weather a lot of an economic storm, so to speak, in medicine, because we work in a very stable field that there's always a demand for. But this has kind of been unprecedented, certainly something I never thought I would see in my career. I think some of the biggest challenges have been that we are not able right now to perform elective surgeries, as you may have seen on the news. I'm going to write down this question real quickly about a reverse shoulder replacement. We're going to come back to that after I finish my yapping here. Let me just see. I've been recommended years ago. Is that still an option? So we'll talk about that. Yes. And I got another quick question. Where is the clinic? Our main clinic is in Concord. The address is 264 Pleasant Street. It's right across from the campus of Concord Hospital. We normally have 3 satellite offices, one in New London. We have an office in Derry and an office in Wyndham. Currently, because of this situation, the Wyndham and New London offices are closed, which is unfortunate. We have a brand new, beautiful office in New London that just opened, I think about a day before all of this occurred. And our Derry office is still opening and available to see patients. So I'm just going to pop this open. Sorry, guys. Get an MRI. There's a question about an MRI. Just to clarify, we are still offering MRIs in our office. It's a patient comfort level, right? And this is pretty much what we're telling patients is if you're comfortable coming in and you're comfortable that we're taking precautions, you can still get your MRI done in our office. So if you had an MRI pending, it may have potentially been rescheduled, but we do still have MRI availability. And what I was getting at earlier is it's really the surgical schedule that's been affected. You guys have probably seen there's national guidelines now on elective surgical procedures. A lot of what we do in orthopedics is elective, meaning this is not a life or death type surgery. It's more like an improve my pain, improve my quality of life type surgery. So the vast majority of what we've had to do has been canceled because of the need to preserve protective equipment like gowns and masks and gloves and things along those lines, so that they are available for in case we kind of see this surge of patients that is likely to be coming with the coronavirus epidemic. I got a question about the walk-in clinic. I guess there was a call and the answering service was told that it was closed. I guess it would depend on what time you called. If you had called after 5 p.m., yes, they would have told you that. And I apologize for any confusion. I literally kind of just spoke to our leadership this morning to confirm that we can accommodate walk-in visits between 9 and 4 during the daytime hours. So I apologize again if you were given any misinformation on that. I think what would be helpful is if you're a patient who thinks you have an acute issue that you want to get seen for, giving us a quick call in advance is never a bad idea. We can do some of our screening questions by phone. At times we can even have one of the doctors assess you by phone or with a telemedicine type visit before you need to come in, which can sometimes even, minimize the likelihood that you'd have to come in the office. So you can always call us first. So we've made a lot of changes. We've been offering a lot of services to patients via telemedicine, just like this, using FaceTime, Google Duo, any sort of like online application, like the equivalent of a Zoom type meeting where we can meet with patients face to face. And honestly, I've been at it for a couple weeks and it's worked great in the vast majority of patients. And we can do physical examinations. We can kind of go through treatment recommendations. Like I said, our hands do become tied on some things. For example, not all physical therapy places are open right now. There are places that limit access, so therapy has been a little bit limited, but there are places that can provide care. If you need something like a cortisone injection or a face-to-face appointment, we can also make arrangements for that, but we're trying to keep patients who are more comfortable being home, staying at home. Serve a question. I have going to take a peek at that. Sorry guys, I'm just jotting down a couple things. Patient, can I make an appointment? Yes, if you're an existing patient in our practice, there's a question, can you make a new appointment for another issue with another doctor? Yes, we are always accepting new patients. There is no doctor in our practice, to my knowledge, that is restricting any sort of new patients, with the exception of in rheumatology. Our rheumatology department right now is potentially may have some restrictions on that. So I would have to potentially get back to you. Goodness, this is crazy. I have all sorts of questions. I think I can scroll back. So let me start answering some of these, since now I don't have to talk about my personal life anymore. So there was a question that came through about reverse shoulder replacement. A gentleman apparently mentioned that he was recommended for this. So reverse shoulder replacement has not changed a lot. I think the question was, are there any sort of, newer type options than a reverse shoulder replacement? and there are not. I do shoulder surgery. I mean, probably 85-90% of my practice is shoulder surgery. So I'm kind of up on the latest and greatest in shoulders, and there's certainly no new technology beyond that to my knowledge. So a reverse shoulder replacement, which is typically done for people with arthritis and chronic rotator cuff tears, is still kind of the state-of-the-art treatment. So I don't know the specifics of your condition, but it's something that we'd be more than happy to consult with you on, talk about whether you'd be indicated for this type of procedure. So if you're not already established in our system, you're welcome to give us a call and we could take a peek. The other question that popped in was regarding a patient with some shoulder pain, asking about could this be related to something called SIRVA syndrome. SIRVA is, I think an acronym is the word. It's like a capital SIRVA. And it's basically a syndrome that develops after a flu vaccine, where you can develop chronic shoulder pain as a result of the vaccine itself. It's not, frankly, that well understood, but it's thought that, if the vaccine is placed in a position where the medication that's delivered for your flu shot is put a little too close to the bursa or the structures of the shoulder, that it can lead to chronic inflammation in that area, and as a result, chronic pain. It can be a little difficult to distinguish it from other things. So in some cases, it may present almost like a bursitis or tendonitis in your shoulder, but if you feel that the onset of your pain was at the time of the vaccine and hasn't resolved since the vaccine, then yes, it could potentially be related. The vast majority of those cases will resolve over time. Many patients have some local sensitivity from injections that can resolve in days or weeks. Some people do end up with more chronic symptoms, often can be treated with medications, physical therapy, occasionally cortisone injections to settle down inflammation in the bursa. And in rare cases, there could be a role for a surgical debridement type procedure where we kind of remove some of that inflamed bursa tissue in the shoulder. So that's something we would be happy to see or treat in our office. So that covers reverse shoulder and SIRVA. And for the folks who wrote in with those questions, if you want me to provide any further clarification, you can just pop on. I'm more than happy to. The next question was, this is regarding rotator cuff impingement, was diagnosed a couple months ago. This individual has been working on some exercises and it feels like it's getting a little bit weaker. Does this warrant a visit? Like I said, the beauty right now is with some of the remote applications we have, this is super easy. We can do a telemedicine type consult. And if that's something you wanted to schedule, you could call the office. We can run through a physical exam, talk about the progression. But the long and short of it is, if you have unresolved pain that's not getting better, then of course that always warrants a visit. And I think the beauty of orthopedics, especially in a crazy time like this, is it's your comfort level as a patient. If you don't feel comfortable coming to the office, if you'd rather wait, that's okay. I don't think you're doing any harm by waiting. But if you do want an appointment, we've got plenty of availability. We're more than happy to do like a remote or an in-person visit to check on your issue and figure out how we could help you better. So next question, this is a pretty detailed question. Goodness, sorry, this goes on for a little bit. Sounds like there's some numbness, might be a spine issue. Okay, honestly, this question looks like a little bit maybe more than what I could potentially cover via web. I would say that Dr. Androla right now is one of our providers who's currently not seeing patients in the office. We're kind of working on a much more limited staff with the coronavirus situation. The other sports doctors in our group, myself included, Dr. Casey, Dr. Higgins, Dr. Nordzi, Dr. O'Connor, and Dr. Moran are all kind of taking over for him. So, like I said, this is a little more detailed question than I might be able to cover just by a Facebook Live type setting. But any one of the five of us would be happy to get you on our schedule and kind of assess and take a peek. Especially there was a mention of some MRI findings, which I could not take a look at. So, but like I said, don't think just because of this coronavirus situation that we can't help. We can. That's our goal. And that's part of the whole reason for this message is us trying to get out the word that we're not leaving anybody hanging here. We want to care for you as well as we possibly can. I know Personally, even with my own doctors, it's a little bit of a kind of daunting feeling to think, well, geez, I mean, am I going to get the medical care I need? Am I going to be able to get my groceries in a week? Am I going to be able to resume life? And so I think there's a lot of unknowns, but we're definitely there and available. So, what else do we have coming through? Oh, some of my nice former patients. Thank you. It's good to see you guys. Sounds like a follow-up visit. What can I do to alleviate some of the pain? It sounds like this patient here who's due for a follow-up has started some physical therapy and is, still struggling with night pain. So I don't really know what the particular issue there is, having not met, but I would say that especially with patients with shoulder issues, pain at night is a really common complaint and nobody knows why. So I don't know what it is about shoulders, whether it's a rotator cuff issue, an arthritis issue, a tendonitis issue. For whatever reason, it always tends to be worse at night. I think to some extent when you lay down, some people theorize that, maybe the fluid shifts in your body may make it more painful, but there are many patients who can go all day with no issues and they go to lay down and the shoulder just starts throbbing, right? And what makes people crazy is not being able to sleep and rest. So you'll see that patients with significant night pain are really kind of desperate for solutions to try to make that better. So as a general answer to this question about still struggling with pain at night, there's a variety of options. So if you're a patient that can tolerate anti-inflammatory medicines, like Motrin, Aleve, Advil, even Tylenol over the counter, that can be an option. Tylenol PM has Benadryl in it, the component of Benadryl, which can definitely kind of make you more sleepy. So that's an appropriate thing to try at night. Added benefit is it may help spring allergies a little bit. So that's a plus. And if your pain is beyond the point that it's being controlled by those means, that's when you want to check in with us because cortisone injection can be helpful for something like night pain. There are prescription medicines that can help with night pain to help address some of those symptoms. So that's when you want to be giving us a call. I think in general, we do try to, with limited exceptions, try to steer clear of things more like narcotic type medications. It's typically not the first route we like to go, but there are exceptions to that, especially in post-surgical patients who are struggling with pain at night. So I would say feel free to touch base if you're not doing well, and we can reach out with some options for you. So what are some best practices that people can do to stay healthy? So I think you've seen a lot of these on the news. I mean, obviously hand washing is huge. And I think remembering that the duration of time it takes with soap to scrub this virus off is probably a minimum of 20 seconds. So a quick hand wash is probably not sufficient. If you're going to do this, it needs to be a very thorough hand wash. Obviously avoiding kind of any close contact with a person where, a droplet can be spread. That's how the virus is typically spread, is by droplets. And I will mind you, I am not an infectious disease specialist. I'm an orthopedic surgeon, but these are kind of routine precautions. I think it is being suggested now using even a cloth mask in public, especially if you can't maintain a 6-foot distance from another person, is probably not a bad precaution to take. And then some are suggesting, things like wiping down your groceries, your deliveries, anything that comes from an unknown person into your environment could potentially be contaminated. So you want to be cautious about that as well. So can I do a telemedicine rotator cuff surgery? I'll tell you, I would sure love to, because I think as a surgeon, when you are completely taken out of a surgical environment, it's certainly challenging because this is what we love to do. And I think probably the hardest part of this, aside from personally just accepting some of the changes that have had to happen with employment in our practice, which has been very difficult, is having to restrict patients from something that I know is going to help them. And I'd say the first week that I had to make a lot of calls to patients and tell them that I could not do their surgery or help them was probably one of the the most difficult thing I've gone through in 10 years of practice at Concord Orthopaedics. As a doctor, it is just a horrible feeling to have to tell someone that they have to continue to suffer and continue to live with symptoms that you know you could fix for them. And it's surreal operating in the United States of America to think that we would be at a point where we have to do that to a patient. But people have been extremely understanding, knowing that none of us like having to do this to people. Most of us are very distraught by it. And of course, we feel for our patients and we want to try to offer them alternate solutions. So what else do we have? I need a cortisone injection after making masks. Yep, that's true. If you spend too much time sewing, you got to watch out. So this is a question about what types of surgery can be done for unsuccessful rotator cuff surgery. So that's maybe like a long answer to a short question. If you had a rotator cuff tear that did not heal, you can revise it, meaning you can go back and just do the same thing a second time around and try to hope that it heals on round two. There's a lot of variables that go into this: the age of the patient, the size of your tear, your activity level. So these are kind of generic answers, but there are some reconstructive options for people with chronic rotator cuff tears, where we say if the tendon is chronically torn, we can take a patch of tissue, like a donated tissue from a cadaver, and we try to place that into your shoulder joint to cover the missing area of rotator cuff. And again, there's very specific indications for that. So if it's something you wanted to discuss, you'd have to call us to see if you're an appropriate candidate. For people with failed rotator cuff tears from years and years ago who have gone on to develop arthritis, shoulder replacement can actually be an effective option, a reverse shoulder replacement, which I touched on earlier. So if you're a patient who's struggling with chronic pain from a failed rotator cuff surgery, you're not alone. I hate to say it's not a hugely uncommon thing. Rotator cuffs, for the most part, heal quite well, but they don't all heal. That's for sure, not even in the best of hands. And so it can be really frustrating and disheartening. So it's something you want to come in and we can certainly talk about. Has the state given any indication on when elective surgery is going to start again? No. And goodness, I would sure like to know. It's, it's challenging because with anyone who's kind of, waiting in this situation and frustrated, it makes it a lot more tolerable if you have a timeline, a sense of, when you might get an answer, and we don't. The hospital, Concord Hospital, has been giving us updates kind of from week to week. And I think depending on if you believe what you read in the news, if the kind of surge in New Hampshire, may be coming in the next 2 weeks, hopefully once we kind of get past that surge, we should have a better idea of when things are going to plateau out and when we would have the equipment available to do what we need to do. So unknown at this point. I've had shoulder and neck pain for 2 months. Could I get a cortisone injection for that? Yes, absolutely. Shoulder cortisone injection is a super easy office procedure. We would obviously have to kind of establish a diagnosis first. So that would just be an appointment or a telemedicine type consult. For neck pain, it kind of varies. We can certainly do neck injections for pinched nerves in your neck, chronic arthritis in your neck. That typically requires more imaging, like something along the lines of an MRI, before we would determine if you're indicated for that. An injection into the neck is a little more of an invasive procedure. So most shoulder injections can just be done in the office. It's a quick, little kind of 5-minute, no different than like a flu shot type thing. Whereas a neck injection typically has to be done with guidance using like an X-ray machine so that you can localize the injection safely because you're closer to your spine. And Dr. Tang and Dr. Nagel in our office are both spine specialists who do procedural injections like that. So a full shoulder replacement, should a person give blood ahead of time? That's a good question. So there are centers that in the past I've heard have recommended pre-donation of blood for things like knee replacement and hip replacement. When I was going through my training, that was a common thing that patients would ask about. To my knowledge, at Concord Hospital, none of my partners who do joint replacement recommend pre-donation of blood. I suppose the only exception might be is if you had an exceedingly rare blood type or a particular antibody that might make it such that you could not receive blood from a typical donor. But for the most part, the amount of blood that we tend to lose during these surgeries is not significant enough to warrant a transfusion. I've been doing shoulder replacement in my group for close to 10 years, and knock on wood, I think I've given one transfusion to a patient, and she's a patient who started with a little bit of a low blood count. So the vast majority of the time you don't need that. So if you were weighing the pros and cons, it's probably not worth the time and risk and effort to donate the blood in advance for yourself, but donate blood in general because everybody needs it. So that's just a separate little push for the Red Cross. So reverse shoulder replacement. Do you have a feel as to when that? Yeah, we were just talking about when we could operate again. What do we have here? Where did I receive my training on shoulder surgery? So I did my residency training at the University of Pennsylvania in Philadelphia. So I was there for 5 years doing everything in orthopedics, from spines to pediatrics to orthopedic tumor surgery to hip and knee replacement. And then I'd say by about my 4th year there, I knew that I wanted to specifically do shoulder surgery. And so I did a shoulder and sports fellowship at Columbia University in New York. And so I spent a year there doing pretty much, it was about 90% shoulder surgery. So, and that's been pretty wild because I've been getting updates from those guys, and the folks that I trained with who are orthopedic surgeons some have been almost like redeployed as ER doctors, asking to do things that they haven't done in a number of years just because they're so desperate for the medical help. So it's been a pretty crazy situation down there. What do I love most about being an orthopedist and what made me choose this specialty? So those are basically the same answer. The reason I chose it is I think that orthopedics is really cool because it focuses so much on restoration of your function. So the majority of patients I see, other than people with broken bones and who didn't kind of choose to have that injury, they're really kind of actively making the choice to get better, right? They're saying, I have a painful condition and I'm going to put in the work and the time, and I'm going to let my doctor work with me to really try to get back to the stuff I love to do. And that's really gratifying. You can imagine in medicine, there's a lot of conditions where, it's frustrating for a patient. You might go to see someone if you, God forbid, you got diagnosed with, lung cancer, or you had a ruptured appendix. There's not a lot of choice in it for a patient, right? You have to kind of go through that process. And I think that's tough. And I think the kind of really neat thing about orthopedics is so much of it as a patient is really choosing to try to get better. They like putting in the effort. They really work hard on their rehab, and to try to get that type of outcome is really gratifying for people. So that's why I like orthopedics. So good suggestion of propping a pillow under the arm for night pain. I like that for sure. A lot of questions about the future for surgery. And, I'm sorry, guys, I hate to say it's like your guess is about as good as mine, but I'm really, really hoping that if we can kind of ride out the next 2 weeks, that we should have a better sense. We can start making calls to patients. I'm not saying we're going to be doing an operation in 2 weeks by any means, but I'm hoping that we'll start to be able to predict a little better when we might have an answer. And yes, we will post this on the Facebook page after. How often can you have a cortisone injection done? Also a great question. That depends a lot based on the person, your age, and the type of thing that you're treating. So say you're a patient with chronic arthritis in your knee, for example. You've had it for years and years, and you're trying to maybe avoid a knee replacement surgery or something like that. You can typically do an injection ballpark kind of every 3 to 4 months to kind of keep that under control. If you're needing an injection more frequently than that, that's kind of a sign that you got to do something more. And the reason we tend to not do them more frequently is kind of a couple. The primary reason is that, the more you do cortisone, the less effective it becomes, right? It's really rare for us to see a patient who's had, 30 cortisone shots in a joint because they just stop working eventually is the problem. And so, people say, could it damage the tissues around the joint? I mean, theoretically, yes, if you've had multiple injections, But for the most part, the reason we stop doing these is because they lose their efficacy. And at that point is when we kind of need to start looking at other options. For other conditions, say you have a more acute problem, say you developed a really acute bursitis in your shoulder and you're struggling, and you had an injection the first time you met the doctor, and you come back 6 weeks later and you're 40% better, but you want to try another one. That's okay. You could do a second injection 6 weeks later. You're not going to be doing these injections for the rest of your life, right? But we will sometimes do a couple in sequence just to try to get you ahead of the pain, and then let it resolve over time. So that varies a little bit. Is there an age after which you might consider reverse shoulder replacement surgery? Lots of good questions on reverse shoulder replacement. So reverse shoulder replacement, we kind of touched on this, is typically done for patients with chronic rotator cuff tears who also have developed bad shoulder arthritis. And usually in the process, they have developed significant loss of function, meaning, if you ask a patient who needs a reverse to lift their arm, they might not even be able to lift their arm to shoulder level. It's just chronic pain, difficulty with simple things like even putting your keys in the ignition or trying to get your hand into a cabinet in your kitchen. If you look at the FDA indication for reverse shoulder replacement, it's technically for patients 70 years and older. But as this has been on the market longer, since 2004, we definitely use it for patients outside of that range. For the youngest of the young, I would not be putting a reverse shoulder replacement in a 35-year-old patient. But if you were 65, would that be appropriate? It probably would. And of course, there's a lot of factors that go into it. So it's not an absolute number, but it's kind of like a relative number that we look at. And in general, the concern with reverse replacement is if you put it in a patient who's too young and too active, and they are to kind of wear through this implant, say they kind of overuse it. If you put a reverse, say, in a 50-year-old who does construction, the concern is if that wears out on them in 10 or 15 years, we don't have a lot of great bailout options for that. So lots of surgeries, we have kind of like redo options that we can offer you in the future. But for surgeries with more limited revision options, we really want to try to reserve those for people who are hopefully going to get that surgery done once, have it for the rest of their life, and then not have to think about it again. And I think I've covered most of these questions. So I think we did pretty good. And we hopefully answered most of people's concerns. For those folks who wrote in that I might have missed, I'm sorry, I'm new to this. So I'm kind of getting used to scrolling and try to answer these. And like I said, a lot of the questions are, pretty detailed. And some of these things are like hard to answer in this type of setting. But basically just kind of to reiterate, we're fully available. If this takes another 2 weeks, if this takes another 3 months, we're still going to be taking care of your orthopedic needs. And if you call us, we will help you determine what's best for you. We can see you in the office. We can do a telemedicine visit. We can simply talk to you on the phone. We're going to make sure that we have that access no matter what. We are, knock on wood, all trying to stay as healthy as we possibly can, and we hope that you are as well. We're going to be doing these chats every few days. Dr. Levy, I think, is going to be on in a couple days. He's one of our spine surgeons, so you can go through your spine questions with him. And if you call the office, we're happy to get you in if you need to be seen. So thanks, everybody. You are all wonderful. I hope everyone is staying healthy, staying safe, keeping your precautions, and maintaining your sanity through this kind of whole crazy, crazy time in everybody's life. So I'm going to just double check that I covered everything. I think we're good. And I'm going to sign off. Thanks, guys. Take care. Bye-bye.